So I'm going to explain in this video a very basic, simplified version of what is known as the packing process breath or reverse abdominal breathing. So the purpose of this exercise, in short, is to begin to work with pressure inside the abdominal cavity. So for the purposes of this video, we're going to think about the abdominal cavity as a big sphere, right? Six-sided sphere, the top being the diaphragm, the sides being beneath and up to the rib cage, the low ribs, the back being into the kidneys and the Mingmen, which is the point, energy point directly across from the navel. And of course, the front side of the abdominal cavity, navel being sort of the center point of that, and then the pelvic floor or the pelvic diaphragm, right? So we have a six-sided sphere here, at least for us to begin to feel into the dimension of this sphere. And when we're working with pressure, a basic understanding of the mechanics, the anatomical mechanics here, are that as I inhale, my lungs are inflating, right? This is very basic. The lungs are inflating, the chest wants to expand, right? When the lungs inflate, because of the mechanism of the inhalation, the diaphragm is actually drawing down into the abdominal cavity to create space for the lungs to expand, right? Connective tissue is actually drawing and opening the lungs downward as the diaphragm moves down, space in the chest up here and in the upper back underneath of the scapula, right? And behind the heart. Okay, so there's expansion in the thoracic cavity, which is the chest space, and then there's compression into the abdominal space. Now, if we were going to do a straight abdominal breath, we would focus on the expansion in the belly and then the contraction or the release and compression back in on the exhalation. And this is what we do for the preparation of reverse abdominal or packing breathing, okay? Is we just will expand a couple breaths. So this expansive breath or this abdominal breathing orients us to relaxing the diaphragm, relaxing the tissue layers and fascia of the abdominal walls so that we can expand in the abdominal cavity rather than expand in the chest. And as you practice this, you'll get a sense of, okay, wow, it takes a few breaths to really relax and allow the breath to drop down into the lower part of the abdominal cavity and even almost all the way down to the genitals. It takes a few repetitions at minimum. If you're not familiar with doing relaxed, natural abdominal breaths, you're going to find that it may take you 5, 10, 15 breaths before you feel a deep sense of relaxation in the abdominal cavity. Okay, so we're creating space, we're creating relaxation in relationship to diaphragmatic breathing, diaphragm moving down on the inhale, and then diaphragm floating back up on the exhale, all right? So that's the preparation. Now, as you begin to orient and practice to the reverse of this, we want to think of this sphere, which was expanding in all directions during abdominal breath, except for up the top. The diaphragm does want to move down as we expand out. Okay, diaphragm is moving down. Same is true in reverse. The diaphragm is moving down, but the sides and the back and the front, and then inevitably the bottom as well, are all going to, we're going to be creating this little bit of feeling and sensation of compression, okay? Compression into a developing or a cultivated center point, right? So the abdominal space is a sphere, much like the cell, and we're learning how to breathe and bring awareness into the nucleus, which here we call the Tan Tien. which is also known as the Elixer Field or the Sea of Qi. And I give the names so that we have a sense of the importance and what is really possible here, the Sea of Qi. And as I teach this oftentimes, the Sea of Qi, sometimes for us, depending on where we are in our development and energy cultivation, will feel less like a sea and more like a drop or a little puddle, right? There's not as much space, expansiveness in the beginning, but this will change very quickly as you learn, as you practice and develop, okay? So we've taken some expansive breaths, maybe 5, maybe 10, maybe only 2, depending on how much you've practiced that kind of breath. And then on an exhale, squeezing and wringing out the lungs, wringing out the breath, and sort of centering down. Squeeze, 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 squeeze. Don't have to overstrain, but there should be a feeling of wringing out, squeezing out the breath. Now, I'm imagining here, for our purposes, this is the process. I am empty of all the oxygen in my body. Now, instead of taking one deep breath and then trying to create pressure, what we're going to do is we're going to segment the inhalation. Now, for most practitioners in the beginning, 2 inhalations is going to end up filling you up, and that pressure is going to be difficult to hold. So starting with 2 breaths is really good. Now, even if you think you're taking 10% of inhalation, you're probably already taking 40 or 50%. So I want you to think in terms of really small incremental breaths. Even if you only take 2 small breaths, you will feel very quickly this sense of pressure and inflation that is difficult. It's challenging to contain and then pressurize that energy deeper and deeper and deeper into the center of the abdominal cavity, okay? So I'm going to practice it here briefly. All the way out. Hands here in front of the Tan Tien. This is a great way to practice. Or hands on the belly. Tongue on the roof of the mouth. Checking my posture. And then I'm going to bring in just a very small sip of air. Imagine pulling just a little bit through a straw. Okay, immediately I feel my chest cavity pressurized. I feel my diaphragm having a difficult time moving down because, again, I'm not letting myself expand. I'm actually gently contracting. This is something that takes practice, right? There's nuance and subtlety here at the tissue layer. Pull it in just a little bit. Relax the whole body. This is really important. As soon as we pressurize the abdominal cavity like this, we're going to start to feel tension in different places depending on your body and what you're working with. You're going to feel tension. So relaxing is going to help you to concentrate more of that energy down into the abdominal cavity or into the Tan Tien. Taking it a little bit and just holding it there, right? Holding it there is good enough in the beginning because there's going to be all kinds of activity in different energy centers of the body, and we're focused on bringing awareness into the low part of the abdomen. Or for beginners who have not cultivated a relationship to the Tan Tien, we're going to go in through the navel. Okay, the false Tan Tien is what it's called. And then from there, we're going to bring in another sip of air. Once there's a little bit of feeling of relaxation and that pressure is sort of stabilized, if you will, then we can bring in a little bit more. Just a little bit. Again, feeling the chest starting to pressurize, relaxing the chest and shoulders. This is really important. When the shoulders are tight, the chest can be tight. So we want to relax and feel this tentorium, if you will, this tent, or this round tent of the diaphragm. And you kind of have to coerce it down a little bit. You got to encourage the diaphragm to slowly pressurize down. Imagine that you're gently compressing down into your internal organs, and you'll feel it. It'll become the charge, the energy of it will be very palpable. You might start feel buzzing. You might start feel increased vibration. Jerking, the body jerking around is a natural response and is encouraged, not on purpose, but to actually allow the jerking and the spontaneous movement to happen. What's happening here is that pressurized chi and breath moving down into the internal organs is looking for space, and the organs are having to adjust. You're essentially pushing and massaging into the organs in order to create space for this chi. And that, through this practice, what happens, again, physiologically, anatomically, is that the chi pressure is being gently pushed deeper and deeper, layer by layer, into the fascia that lines the outside of the organs. Okay, so there's like all these different layers, subsurface layers, and then deeper and deeper into the actual tissue of the organ, say your liver or your kidneys in the back, stomach, all of it, right? So we're breathing it in, we're packing it in, we're gently allowing the body to move. And then when we feel like we can't hold the breath anymore, as a beginner, we're just going to release it, okay? And for most of us, there's going to be this feeling of not strain, but like you just went for a little short run. You had to run from here to there, and it didn't take very long. It wasn't a far distance, but the spurt of energy has us feeling like winded a little bit, okay? And that's okay. So again, inhaling, expanding, compressing in, wringing out the air of the body, breathing in a small sip of air, relaxing the chest, feeling the compression, gentle compression and restriction in the abdominal walls, awareness into the Tan Tien, deep inside the belly, or at the navel point, making contact with your finger or thumb or center of the palms is good. And then you could bring in a little bit more, work it down, bring in a little bit more, work it down. Ultimately, you could break the breath into 10 different breaths, and that just shows you how small of a breath I'm actually talking about. If one inhalation is 100%, what you're trying to do is take it and go 10%, 10%, 10%, 10%, right? But we don't want to do that too quickly because we don't want to create strain. We don't put too much pressure in the system all at once. That's just going to create this little bit of like too much constriction, okay? Now, if we're speaking about the psychedelic realm, I personally use this practice frequently while I'm in psychedelic space, especially if I find myself wandering or following loops or threads of thought and story. What I'll do is I'll come back in, I'll get myself into a nice, good structural position, bring my hands in, bring in the breath, relax by doing the expansive abdominal breathing, then reverse the process, relax my diaphragm, restrict, create pressure in. This is going to both expand my field in this from the pressurizing of this internal space, and you will feel it. It's also going to inform my structure. When there's pressure inside the abdominal cavity, this pressure is also going to start to work on the spine and the connective tissues that the nerves are weaving through. And so my spinal cord, my spinal column, my shoulders, my neck, all the way up into my brain, down to my tailbone, is all going to be informed, right? Again, I have to make space. And if my structure is misaligned, that pressure is going to be challenged, right? And the pressure is also challenging my alignment and my spinal column and nervous system to extend itself toward the cosmos and also root down through the ground. Simultaneously, and this is what we're really developing, is more than anything else, is we're developing the awareness to be able to not control, but to maintain focus and develop the ability to stay inside the Elixer Field, the Tan Tien, for a longer period of time, right? So we're actually going into deep space internally. As that point of concentration actually gets smaller and smaller, we're really actually moving into a wider field. We're moving into a smaller space. So there's internal awareness of the body, and simultaneously there's chi pressure, which pressurizes and creates this field of energy that widens out from the body. We get very in tune with the energy. We get very in tune to the subtle vibrations and frequencies that are moving and aligning themselves in the body, pressurizing not only the physical body, but almost down to the cell, right? So we become this sort of single cell, one single cell of pressure in order to regenerate, reinform, and realign not only the physical body, but also the energy field.